5 years ago, we learned about something called COVID. We experienced lockdown, social distancing, far too many lives lost around the world. And now the World Health Organization, 5 years later, has declared COVID-19 a global pandemic. Now, the CDC is still tracking new COVID-19 infections, and right now the weekly percentage of new cases in the U.S. is low, but there is this lingering mental health crisis that's having a lasting impact across the country. And we've been talking about this even during the first year. We were talking about the mental health crisis and what we were just seeing on the horizon. So let's talk about when we first started to experience this outbreak. And folks were afraid to leave home. They were afraid to go to school. I mean, we know how it started impacting families and kids. You were on the front lines of this as a doctor. I mean, as you think back 5 years, how are you reflecting on this day?
In these moments, I have incredibly vivid memories sitting in an emergency room here in New York City with 3 other emergency physicians looking at a chest x-ray of a young patient who came in with flu-like symptoms, shortness of breath, and low oxygen rates. And the x-ray was abnormal, Kira. It had something that we call multifocal pneumonia, which is pneumonia that is in multiple areas of the lungs, very different from the typical pneumonia that you would see where it was localized. In retrospect, what we were looking at was our first experience of COVID-19. Soon after that case, it almost felt as though patients showed up by the buses with flu-like symptoms, congestion, and most importantly, shortness of breath and low oxygen rates. That was a time that, Kira, I still honestly have nightmares about when I think about how many people were affected by this virus and how crowded and chaotic the hospital was. But since that time, we've made some incredible advancements, not just in learning about this virus, but also in terms of how to prevent it, learning about mitigation measures, the benefits of masking and distancing, also realizing the value of technology, research, and data to produce vaccinations that were protecting millions of people, and then therapeutic interventions like Paxlovid, remdesivir, that we still use to this day. Today is very different from 5 years ago, but Kira, just as a reminder, yesterday I was in the emergency room treating a patient who came in with flu-like symptoms, oxygen rate low, feeling overall just incredibly ill, and a COVID test came back positive. An important reminder that this virus and its threat is still out in our communities, and we must protect against it.
All right, Dr. Darian Sutton, I still can't believe it's been 5 years. Thanks so much.